of research. So why do institutes and universities have seed grant competitions? So it's to help prepare faculty to become competitive for federal funding. So it's the idea, as Sherry was saying, of a seed of an idea that you can then have blossom into a larger project. They're also to facilitate collaborations among faculty and to facilitate faculty use of resources the university provides for research. So thinking about this is an investment of an institute like INCHIP or of a university in faculty research and in helping faculty get external grants. So we think it's really important to keep these things in mind when we're preparing your application for seed funding. Thinking about seed grants, they're usually for pilot studies. And so the purpose of a pilot study is to examine the feasibility of an approach to be used in a larger study. So typically a pilot or a seed grant doesn't produce a study that is a definitive answer on anything. It's really focused on the feasibility of an approach so that you can launch it into a larger study. And here at the bottom of this slide, we've included a link to an absolutely fabulous article about pilot studies and how to use them effectively in research. We've talked a little bit about what a seed grant is for. So what are things that a seed grant is not for is a standalone study. Typically, they're not of enough money or large enough to do a definitive research project. And seed grants are also not for students' research. There are some separate funding mechanisms or funding opportunities for students, but these seed grants are really to support and launch faculty program of research.
All right, so we wanted to kind of talk about what to do before you start writing your seed grant. Because I think sometimes people will just sort of dive in, they see the call for proposals, they dive into their letter of intent. But we want to kind of slow things down and talk about basically the big picture. So the big picture is your program of research. The way I think about any study is where it fits in a program of research. And I think of a program of research as like a book. And every study is a chapter in that book, or like this bridge here, it's a step on the bridge to get somewhere, or a stepping stone on a path. And so all studies should be connected in some way that's very thematic. So when you're thinking about your seed grant, you want to think about where does it lie in my program of research. If you're very junior, perhaps it's one of the first studies in your developing program of research. If you've been doing research for a while, maybe it's your 16th study in your program of research. But it should fit somewhere. And I think it's important in the seed grant to kind of talk about what is that program of research. So for example, I have a program of research exploring risk factors for skin cancer. I do a lot of skin cancer prevention work, so I'm very interested in behavioral risk factors, preventable risk factors to reduce people's risk of getting skin cancer. And so every study is sort of a step towards developing effective interventions to reduce risk. And so you want to make sure that you have your big picture in mind so that you can figure out where this particular project lives in that big picture and isn't just sort of floating around as like a random idea. It is thematic to what you're doing. So it's a chapter in the book that your career is writing about some topic that you are very passionate about. And I should say, it's not that you can only have one single program of research. I actually have more than one. And they don't all necessarily need to connect. But as long as you have a sense of what the big picture is for this particular seed grant, and then kind of work backwards from there. And so, let's see, sorry. So your program of research, wherever you are right now, you want to think, what's the next big study in my program of research? So it's not your seed grant, because that's not a big study. And so this is the first question to ask yourself when you're writing a seed grant is like, where am I going in my program of research? What is the next big step? And then thinking about what preliminary data do I need to obtain external funding to do that big project? So you're actually thinking about your big project before you actually think about the seed grant project. So I want you to do some planning on that big project before you even think about what you would be proposing for the seed grant, because that type of thinking is going to lead to what your seed grant should be. So your seed grant idea, again, should be connected to what is the preliminary data you need for that big study. And then you can design a seed grant pilot study to basically be the preliminary data that you need for that larger study. And eventually, that preliminary data will help you in the application for your larger study. And then kind of around and around you go. You're continuing to collect pilot data that can lead to larger applications, as opposed to sort of doing little studies that don't seem to be very well connected. So again, the big question is, before you start your seed grant, what is the next fully powered study in your program of research? Think about what the funding mechanism is that you're going for. So is your end game, your near-term end game, to get a K award, to go for an R03, an R21, an R34, an R01, maybe a foundation grant that's several $100,000 or something along these lines. So have that in mind. And the reason why I ask you to have that in mind is because the type of preliminary data you need for those different funding mechanisms is going to vary. So you want to plan your seed grant accordingly to the funding mechanism that you're shooting for. So for example, the type of pilot data you might need to make a compelling R03 application is going to be very different than the type of pilot data you would need, say, to prepare an R01 application. So it's really important to kind of have that clarified in your mind. So then I would go a step further and actually draft my specific aims page for that big study, not the seed grant, we're not there yet. So what is that big study that you're doing? Now, it doesn't have to be a well-polished specific aims page. It can be a crappy draft, but just so you have a sense of what the design and methods are for this big study, as well as the scope and funding mechanism. And so let's say you would like to go for an R21 at NIH. So now you kind of draft that specific aims of what that'll be. And then you want to think about, what are the preliminary studies that I need in order to have a competitive R21 application? And now we're finally getting to what your seed grant should be. So you can see we've kind of really backed the bus way up to the beginning and are sort of planning forward on this. Still mine? Yeah. Okay. So I pulled this from the NIH grant instructions. So there's a section in the grant instructions for NIH around preliminary studies. And it says, for new applications, include information on your preliminary studies. So you'll have a whole section in an NIH grant where you describe all the studies that led up to that grant. So this includes studies, data, or any experience you've had pertinent to that application. So now I put in red some language that I actually want you to completely ignore. It says, except for R21s, R03s, and R15s. And the reason why I'm telling you to ignore that is because that is not true. When you write an R21 and an R03 or R15 or any grant to the NIH, there will be an expectation among your reviewers that you have some pilot data. And it's not that you have to. NIH doesn't mandate that or tell you that you have to do that. But the reality is, other people writing these grants will have preliminary study sections. So if you don't, you're going to be one down. So I always would ignore what they say here. Have a preliminary data section in any grant to the NIH that you write, including K awards. And so I think it's kind of one of your most important sections of the grant, because you really want to convince reviewers that you can do this. And that includes early stage investigators and so on. The more seasoned you are, the higher the expectation will be on that preliminary data, though. So that's something to think about. If you are an early stage investigator, or it's a training award or that sort of thing, the bar is going to be much lower for your preliminary studies. But make no mistake, it will be important to have that in there. Most people do, and so you want to be competitive.
Okay, so what kind of preliminary data do you need to obtain external funding for the project that you want to do? So this does depend on the design of the large study. So if you're conducting an RCT or a prospective cohort study or some other design, the kind of preliminary data that will support that you can do what you're proposing to do will differ on the design. And if you're not sure, you can always seek guidance from an experienced investigator on the type of preliminary data study sections will expect for your study and funding mechanism. So as Sherry just said, the bar for preliminary data for an R03 is much lower than for an R01. But you really sort of want to think through what you need. So we're going to talk about some common types of preliminary data that people often need.
And I can't emphasize that point enough of if you're not sure, to find out from somebody who's written those grants before, because there are norms. And if you're new to writing NIH grants, that's the best way to sort of figure out what those norms are. Like, what do people expect in an R21 application, for example, from a preliminary study standpoint?
Yeah, so some common types of preliminary data, so thinking about feasibility outcomes that you might test in a pilot study. First one is recruitment. So can you recruit the population that you're trying to recruit for the pilot and for the larger study? And is the sample you recruited representative of your target population? So for instance, if your pilot study has 20 participants in it and it took you 6 months to recruit them, that's probably not the recruitment yield and the recruitment pace that you'll need for a larger study. So part of this is convincing people that we can recruit the people that we want to recruit and that we can do it at the pace that we would need over the timeline for the next larger study, whether it's an R03 or an R01 or whatever.
Let me give you another example of that. So I wrote a pilot study grant application to the NIH, and what we were doing was it was kind of a site randomized pilot trial, and we needed to work with psychiatry clinics, and we had enough for the pilot in our local region, but the reviewers, when they saw, because we said, we have sign-on from these, 6 clinics across 2 counties and so on and so forth. They came back to us and said, okay, that's great, but how are you going to get the number of clinics you would need for your larger study? Like, convince me that you would have access to 24 clinics or whatever it was that we would need, because it seemed like, from their perspective, we may have saturated the local area. So whether it's clinics or subjects, you just want to be sure that you have quick access to that population and a way to recruit them very swiftly for this study as well as studies to come. So like if you're studying a rare cancer and you actually don't have good access to people with that rare cancer, that's going to be challenging from a study section standpoint. So great to prove that you can recruit that study population.
Yeah, and even if it's not a rare population, say if you're recruiting adult primary care patients, being able to say, we piloted this in, these practices and we can get this recruitment yield of eligible participants over this time period, and our mechanisms and our relationships around recruitment work, that is really strong preliminary data to support a larger study. Whereas like, I've reviewed grants and taking a look at a grant where they're like, oh, well, we're going to recruit 400 people and have no experience recruiting that population or from that setting, that's worrisome from a reviewer standpoint. So demonstrating that you can recruit the people that you need and at the pace you need for the larger study is a really great use of pilot funds. Also retention. So can you get fairly complete follow-up data from your participants for the time points that you're going to want to retain them for? Can you retain them if you have, if your pilot study is a two-arm pilot trial? Do you get similarly high and similar retention across the 2 treatment arms? Are you losing, are there people that you're losing that makes it so that you have biased follow-up in a particular way? Depending on the population, are there other things that are preventing follow-up? So for instance, I've done work with pregnant and postpartum women, and I've had a reviewer say, is the rate of incident pregnancies and follow-up going to mean that you don't have follow-up weight data on some of your people? And so they wanted sort of preliminary data on, are the women who are in our study going to be like pregnant at follow-up and therefore we can't get data from. So being able to say, okay, are there any issues about retention of your population on the timeline that you want your bigger study to be?
And a lot of this has to do with your retention procedures. And so this is another place to maybe tap the expertise of somebody who has worked with that population if you haven't. Because there are kind of tricks of the trade in terms of how to retain certain populations, what sort of procedures to use. For example, in one of our studies, one of our retention procedures actually occurs before randomization. We have a webinar that we use to explain to our participants what it means to participate in a randomized trial and the importance of follow-up. And so we do kind of a little bit of research literacy with them. We noticed that after we did that research literacy webinar, we actually had far greater retention rates because people sort of understood like why it was so important to us that they attend follow-up. And even if they dropped out of the intervention, we were seeing high rates of retention because they figured, oh, this is important. I want to make sure they have their complete data and that sort of thing. I think it's also important when you go out into the community where, let's say you're working with clinics or community centers where it might be hard to track people down. The reviewers will want to see that you have the system that is successful in place to track people down. And so the pilot studies where you can sort of test out that system and be able to kind of fix any things that might have went wrong from a retention standpoint.
So a great thing to test in a pilot study is the assessment procedure. So is what you're proposing, is how you're proposing to collect the data feasible and acceptable? So for instance, do participants complete the measures appropriately? Do the baseline values look as you expect? This is also a great place to demonstrate that for a larger study, you can get the data you're looking for. So for example, if you're doing a study in which you're intervening and have participants fill out questionnaires or surveys, and you're also abstracting data from the medical record, are you able to obtain their records? Are you getting the information you think you're going to get from their records? Is your mechanism and your procedures for doing that getting you data and complete data that you need from the medical records? One of my current studies right now, we're measuring the time people are spending on Facebook. And I'm glad that in the pilot studies, we're able to work out some bugs in that. For instance, we have found that the app that we were going to use that for Android phones updated and no longer collects the data we want. And so we're having to pivot and use a different app. And so having, pilot phase be time when we can, figure out the different options and have, implement backup plans for some of these things. It's much better than if that's the outcome of a fully powered efficacy trial and then realizing that there's a problem with the assessment procedures. I'm also thinking about your population. Are the assessment procedures as planned too burdensome for the population? Are you getting the data that you want to be able to get from people? So for instance, I'm a co-investigator on a study of older adults with atrial fibrillation. And as part of a pilot study, we did the entire battery of measures, which takes about an hour and a half at baseline. And we're able to say, okay, well, in this smaller pilot study, 98% of participants were completely fine doing an hour and a half of measures at baseline, whereas, that is something that people might be concerned about. Is that too high participant burden? But being able to say, well, we tested these procedures on, 40, 60, 80 participants and 99% of them were happy to do it. So really getting at, is the procedures, feasible and acceptable? If you have complicated sort of participant flow through a study, do you have the tracking systems and procedures in place to track people and keep track of them?
Related to the baseline values, look as expected, you might say, oh, well, I'm using a validated questionnaire measure. That's not going to be a problem for me. Well, we did a study where we were measuring exercise with a validated measure, been used in many, many other studies. And our population were people with obesity who we wouldn't suspect were currently exercising. They were enrolling in a weight loss program. And at baseline, and we were looking at the values, it appeared that they were actually more active than the general population, which I think just probably couldn't be possible. Why would we be attracting people who are exercising for over an hour a day when most people don't, particularly people who are struggling with their weight? But it wasn't until then we realized like maybe this wasn't the best survey to be using, even though it's validated, it's been used in all kinds of different populations, but for whatever reason, it wasn't producing the baseline values that were looking good for us. And then that has implications if that's the main outcome, because then if you want to detect change with that, then it's going to be really, really difficult if those baseline values are all over the place. And so I would just never take anything for granted, because it might seem like, oh, like why do you need data on these types of things? But it's so important because you don't necessarily have data on the population that you're recruiting, even if you're using validated measures and things like that. Because some of these outcomes might seem strange to you for a study of since when is recruitment an outcome or retention? or assessment procedures. But for a feasibility study, these are the most common types of outcomes, and super important, because if you're going to identify a problem or a screw up, best to do it in a small pilot study than obviously in an R01 where there's no opportunity to pivot once you've gone down the road with this particular methodology.
So another important thing, if you're doing, if your next larger study is going to be an intervention trial, is, in the feasibility or the pilot study, to think about intervention delivery and what can you test out in a pilot around how you deliver the intervention. So, for instance, implementation logistics. So it could be as simple as like, do we have a room where we need to have the room, and can we get there? Or do we get locked out of the room? If we're going to deliver it online or through technology, is there any problem with how we're delivering the intervention? You can assess treatment fidelity. So do interventionists deliver the intervention as expected? And it's always better to find out that there is a problem with treatment fidelity in a pilot study than in a large efficacy trial. So for contamination, how much contamination should we expect? Did the contamination controls work? Is there something else we need to do in order to assess how much contamination is happening, or proactively reduce potential for contamination? Acceptability, did participants like it? Especially if it's the first time an intervention, you're developing an intervention, it's the first pilot of it. Do participants like it? Would they do it again? Would they recommend it to a friend? What did they like about it? What didn't they like about it? Here, we've often used some sort of liker type questions around, how satisfied they are with treatment, whether they would do it again, whether they would recommend it for a friend. And then also we often do focus groups or follow-up interviews, and getting at more of what best did they like about a new intervention, what did they not like, what suggestions do they have, what did they find most useful, that sort of data, which is really helpful, not only for being able to convince grant reviewers that it's great as is, but in the case that the intervention isn't perfect yet or isn't workable quite yet, it gives you hints on what to change, or how you might want to shift or adapt it or modify it for the next trial or the next study. You can also get information on sustained participation in treatment. So did participants attend or participate in most of the intervention? So if they're in-person treatment visits or telephone counseling calls, what % of them did they participate in? If it's an online intervention, how long did they stay engaged with the intervention? What % of poster interactions did they engage with? This is really important, because you can have retention in the study, but if people are not participating in the intervention, if somebody isn't participating in the intervention, they're not going to be really getting the treatment that you're as intended. And it's much better to sort of fix problems with participation in the treatment at the pilot phase, and adjust and adapt and maybe do another pilot study before moving on to a larger study.
I have a good example of that. I was reviewing a grant not that long ago, and they had a telephone counseling piece to their intervention. And in their preliminary study section, they're describing their pilot data, and what they found was that there were possibly too many phone calls in the pilot data because people only participated in a certain percentage of them. And so then for their bigger study, they proposed using a smaller number of phone calls. And I really appreciated that they knew that and thought that through and tested that. And then it made me kind of trust their judgment in terms of how they were designing this intervention, because they've already kind of, gave it a trial run, they noticed some different things, and then they're doing some tweaking. And so I liked seeing that thinking in the application, just to kind of reassure me, like, these people know what they're doing. This isn't their first rodeo, and they're tweaking based on what they've learned so far.
Great. So another thing that you can test out in a pilot study is to establish or to demonstrate a community or clinical partnership. So is the partner engaged in the research, and if so, how? Can you demonstrate buy-in at all levels? And what are the barriers, and how will you plan around them? And what are the potential scalability or implementation barriers? And to sort of think through, like, if you're going to be, recruiting out of a clinic, does that work? Are there logistic problems with that? If you have, if you're working with, say, in my line of research, if you're working with OBGYNs who are going to refer patients to you, and that you're going to sort of come back to them with something like, does that work? Is it is it going to work for the larger study? Is the clinical or community partner engaged in sort of the research process, and how?
I have a good story for this one. It's another fail. It sounds like everything I do doesn't work. But so we did a pilot study we were doing this in a community mental health center. And what we wanted to do was train the direct care workers to do some diabetes prevention counseling. And the clinic directors or the community center directors were so excited about this. So they were like, yes, we want to work with you. This is so important. We were focusing on a population of people with severe mental illness. And so we came in, we got our pilot funding, everybody's super enthusiastic. We came in to do the first training, and so we're all like totally pumped. We've got all the direct care staff in the room, and like there we are, and we're like, this is so important, diabetes prevention. And we didn't get 15 minutes into this training when it basically went completely off the rails. The direct care workers were basically like, we're not doing this. We are very busy. We have patients who are sometimes they have great needs. They're not always stabilized. This is too much. And so we had to spend a lot of time kind of talking about how this could fit within their workflow. Like by the end of the training, people were certainly more on board with it. But we thought we had an engaged clinic, but we only spoke to the higher levels of the clinic. We hadn't actually spoke to the people whose work we would actually be impacting. And then what it ended up turning out was that there were peers who were they were also at the training. They were very enthusiastic about it. And they said, this is something we can do. And we think we would be very effective at it. And so we ended up pivoting during that pilot and having the peers actually run the diabetes prevention program rather than the direct care workers. Then we kind of downshifted with the direct care workers, and they agreed that they would amplify what the peers were doing, but they wouldn't be the kind of the main intervention delivery people. If I hadn't done that pilot, this would have been just a complete disaster if we had a large trial, because it required so many pivots away from plan A. It wasn't even funny. But we did end up working through it and kind of modifying the program. The peers delivered it. It worked out very well. We published the paper. But it was kind of a lesson in really understanding buy-in from a partner at every single level. And so thank God for pilot studies, I think, in that case, because that was a super important experience. Is it me? Okay. Yep. All right, so common designs for pilot study. You might do things like a single arm trial. So if you're doing intervention development, you might have a single arm trial just to sort of work through like a pre and post version of your intervention study. You might also want to look at the feasibility of your control or comparison group, in which case you might want to do a double arm randomized feasibility trial to test an intervention. Where you want to be careful about is that your double arm trial, the randomized trial, is going to be underpowered for your main outcome. And so in your preliminary study section, so let's say it's a weight loss study, I do a lot of weight loss studies too, and I have an underpowered randomized trial as my pilot study that shows a null finding. That gets tricky to talk about in a preliminary study section. So I will only include a double arm trial if I really, really need feasibility data on the control group or the comparison group that I'm using. Otherwise, I just worry about putting forward what might be perceived by reviewers as a negative trial, or make them concerned that, maybe this isn't going to work because you didn't find a significant effect, even though you weren't powered for it and it shouldn't be expected. But the reality is that can be a tough thing to talk about in a preliminary study section. So if you don't need to do the full randomized pilot, you can do a single arm as a result. And I've been doing that approach actually more so lately than the double randomized feasibility trial. Focus groups are also fantastic. I think qualitative research is so undersold because it's so incredibly important if you're doing any sort of intervention work, you really want to inform it by the population that you're targeting. If you're doing technology, usability testing is super important, something that you can do with seed funding, survey studies, secondary data analyses. So all kinds of different types of designs you could use in a seed grant. And again, it all comes back to what sort of data do you need for the study that you want to propose.
Yeah, so an example of a survey study that I used as preliminary data is I did a K where we were developing a web-based intervention for gestational weight gain. And so part of my preliminary studies for that is I did a fairly short survey of a bunch of women who were pregnant receiving prenatal care at the obstetric clinics at the institution I was at. And I asked them basically like, do you want what I'm offering? And was then able to, as preliminary data, say, we surveyed our target population and the women that we would be recruiting for, for this study that we're doing as part of the K grant. And like 97% or 89%, I forgot, a very high number of them wanted what I was offering. And so being able to say, here is, interest in the target population, or, here's a needs assessment, and being able to say, what we have offered people are interested in doing, or they would be willing to do it, that kind of things you can get out of a survey study. Secondary data analyses, also sometimes you can use previous data that you've collected in a previous randomized trial and looking at a subgroup of people if it's something that's leading off of previous work, or, you can look at barriers or effects or something else in somebody else's data, or even in a large national data set that supports the feasibility of what you want to do, or of interest or of need for the data that you're proposing.
Okay, so hopefully this is coming through so far. So things to include in your seed grant application. I would describe the larger study you have in mind in the aims. I mean, on that aims page, you don't have to spend the whole aim page on that. In fact, it could just be a sentence where you say something along the lines of what I have here. This work will support an R01 application to, even mentioning the program announcement, for a fully powered randomized trial of behavioral therapy for depression compared to usual care in undergraduate students in a university counseling center. So this really sets a frame for your reviewers to know like where you're going with this and what that big study is. And then they'll be able to know like, okay, is what you're proposing make any sense if that's the direction that you're going? If you don't tell them the direction that you're going, I think it'll be much more difficult for them to evaluate your application in any way that will be helpful to you, for sure. Let's see. Anything else to include in a seed grant application that I haven't mentioned? I just want to not rush through that.
Well, I would also say include whatever the program announcement is asked for. So specific seed grant applications may ask for specific things, like read through what the ask is and make sure that you've addressed everything that they want. So some seed grant applications will specifically say, we want a paragraph, we want a half a page on the aims of your larger study. So even beyond mentioning it, they may want specifically that. They may say, please in your budget justification, describe how the investigative team's experience set you up to do the seed grant, or whatever else it is. So make sure, I guess this is good feedback for any grant proposal, is follow the directions. But really make sure, seed grants, different funders and different institutes will have, different specific things. So it's not just sort of a standard application, see what they're interested in, particularly for that program announcement.
I'll often do a step at the end where I'll go back to the instructions and just sort of make sure I can check off everything they've asked for. Because sometimes when you go into grant writing mode, you're kind of like in your mode and you're writing it like you always write it, and then you might forget that there were different expectations for this one. So like when you're done, you can always go back and be like, okay, did I cover all the bases that they wanted? Because you would hate it for it to go in and then they had some special request that you totally missed, and then they bounce it back to you, or you lose points based on that. That would be very disappointing.
Yeah.
Okay. All right. Additional considerations. So obviously you want your seed grant to lead to publications. Now, this is particularly important if you're a junior, because you want to build your reputation in a research area. And of course, how people gauge your reputation is by your publication record. They want to see, do you have experience in this area? So I'd make sure that you have a sense of what the papers are that could come out of the seed grant. And ideally, maybe more than one paper, maybe several papers or a series of papers that you could carve out that would be coming from the data that you're collecting. I always think it's important to really squeeze any grant for any paper that could come out of it. Like, you want to just take as much advantage of the data that any grant produces as possible. So it's helpful to kind of think about what will the papers be from this. And then you can also kind of make a writing plan if you're going in with other investigators and say, so I'll write up the main thing, you're my co-I, why don't you take off this piece or this piece, and then you have a plan from the beginning, and people can kind of hit the ground running with the writing part. Because sometimes you get your seed grant done and you're like, oh, now I got to analyze my data and I want to write the next grant, and then the manuscript part just sort of fades away because you want to get the next grant out. So you want to kind of have that plan of what the peer review publications are. They're super important for your biosketch, not only to show your reputation, but also to show that you've collaborated with your team members. So you want to make sure that the seed grant, you already have your team together at that point. So you don't want to be like, well, for the big grant, I'll bring in a computer scientist because I'm doing some work developing an app, but I'll just bring them in later when I write the big grant. I would bring in everyone you're going to bring in at the point of the seed grant so that you can kind of start that team working together, get some papers together, and that sort of thing. To the extent that you can use it also to provide training opportunities for your students, better yet, because then that gives them opportunities to hop onto papers. And they can be very helpful in drafting papers, because obviously our students are extremely motivated to get publications, and so we certainly want to put them to work at that. So then maybe while you're drafting, the beginning of the next grant application, they could be working on putting together method sections of manuscripts and things like that. So engaging the students is really important. It'll be easier for them to intellectually engage in the products, manuscripts, other grant applications, and so on. So this is on the job training for them. I'm still okay. So we wanted to talk a little bit about budget, and every seed grant notice will probably have specific instructions around this, but we wanted to just kind of give some general recommendations. And the basic thing is that your seed grant budget should really just cover what you need to execute the project. They're usually smaller budgets, so they're not going to cover necessarily your summer salary or things like that, or co-Is. They're usually, maybe some RA time, participant incentives, of course, supplies, fees for any services that you might need to be using, travel that is necessary to execute the project. So let's say you're having people drive out to Hartford or something like that. You could include travel expenses and that sort of thing. In terms of don'ts, that's kind of the right column here. I already mentioned salary. I wouldn't fold in conference travel. Seed grant really isn't for that type of thing. I guess if your particular announcement allows it, that would be fine. But you just don't have the money for that. I wouldn't want to burn, $1,500 of a $10,000 seed grant so I could go to a conference, because the money you're going to really want to preserve to do the project. You don't want to sacrifice that too much. Typically, they're not going to allow you to put on computers and things like that, or furniture, or admin support. So putting kind of the wrong things on the budget can also send the wrong message too. So if I saw somebody kind of putting laptops and things on there, I might kind of feel like, maybe they're just sort of using this to get some computers and that sort of thing. Are they really thinking about how they can be best using this budget to do the work, and not shorting that? So I would just kind of be careful about optics in budget too.
Yeah, and so some things I've done with budgets is sometimes seed grants are for a very small amount of money. And so sometimes you want to propose to do something that will take more time and effort than you will be able to support on the grant. So also sometimes I've included in the budget the the in-kind support or other support that will make the project feasible. So what I'm proposing to do in the pilot study, maybe, it only supports 5% of a research staff's time. But if I can say, this will occur over these semesters and I already have these undergraduate students who have already signed up to participate in my lab for research credit, and they will contribute these number of hours, and do these tasks on the project. Or, I have a graduate student who has this amount of time that they can support to this, and that how they're financially supported will allow them to contribute this amount of in-kind effort to the project. Then you can often say the project that I'm proposing is feasible, even though not all the money is coming from the grant fund, the pilot funds itself. So sort of thinking about, and that's always important to also to think through is, what are you proposing to do in your seed grant or your pilot grant? And, do you have the resources to do that either through the direct funds of the seed grant or from other funds you have? Or you can say, well, I really need a 20% research assistant on here. I can afford 10% on the grant, and I'm going to contribute 10% effort from my, startup funds, indirect funds, other funds that you have, but being able to describe how it's feasible.
Right.
Okay, so one thing is, how many pilot studies do you need to get an R01? And I'm sad to say often more than one. So it depends on, of course, like what the pilot studies are and sort of how they come out. So if you have a pilot study where it's a spectacular failure that teaches you a whole lot, well, that's not going to support an R01, and you'll definitely need to do another one. Also, sometimes, depending on what the big study is, we just need more than one smaller grant or smaller project pilot studies in order to get where we have the kind of preliminary data that would support an R01. So we wanted to walk you through an example from my program of research of needing a couple of pilot studies to, get where we're going, which is eventually an R01. So here, this is an example, again, from my program of research. So our big question here is whether we can deliver a postpartum weight loss intervention via Facebook groups that gives us the same weight loss outcomes as we can if we deliver the treatment in person. So this comes out of work we've done, looking at postpartum weight loss. And so some women obviously lose weight very quickly after pregnancy, but for about 20% of women retain at least 10 pounds a year later, leading them, some health effects of that longer term and complicating future pregnancies. But we noticed that in this population, there are a lot of barriers to attending treatment in person. And so, we wanted to say, okay, can we deliver the same weight loss intervention via Facebook that we can in person? So again, this is like big idea here is I'd love to do, a big RCT, I know the non-inferiority design, comparing Facebook delivered intervention to an in-person delivered intervention. So same intervention, just difference in delivery. But, you can't jump right to that big study. So we started back in 2014 with a pilot grant from the Joseph P. Healy Endowment Fund up at UMass Medical School to do a one-arm pilot of the Facebook delivered intervention. So we had 19 women, and we were focusing just on feasibility outcomes. So I can tell you a little bit about that. Just to say that the Joseph P. Healy Endowment Fund grant was for $6,000, which is not a huge amount of money, but we've been able to leverage that into a bunch of research. So this is sort of so we had the small pilot. We currently have an R34, which I'll talk about, and then what we're aiming for is an R01 through NHLBI or NIDDK to conduct the fully powered non-inferiority RCT. Looking at weight loss as the primary efficacy outcome, and then looking at cost effectiveness. So we did this one-arm pilot study, 19 women, and what we got out of this was a demonstration of the initial feasibility and acceptability of the Facebook delivered intervention. So this is, I put on the screen like a screen grab from the R34 application. So here, as you can see, we talk about that we were able to recruit women, that we had 95% retention at the end of the intervention. We also, for a 12-week intervention, we had asked women to report their weight weekly, and they did so on an average of 10.5 of the 12 weeks. And we have a measure of sustained participation in the intervention. So 42% of people or women participated on the last day of the intervention, and 89% within the last 3 weeks of the 12-week intervention. We also report weight loss, and we also report acceptability here. So I have a little screenshot also of the paper that we published on this. But this is sort of the main data that we got out of this pilot study.
And this is, I know this slide, you might be like, why is there so many words on this slide? Like, this is actually from the preliminary study section. So that paragraph you can actually use as a template if you'd like, if you're doing something kind of similar of how to present this in your preliminary. And you're not going to get a lot of room. So that was like a study that probably took you over a year to do. And that's about as much room as you're going to possibly squeeze in to describe how that worked out.
Yeah, so then, so we use this as part of the preliminary studies for applying for an R34, which I'll talk about in a second. But, this was not the only thing that we had in our preliminary study section. So this was about the initial feasibility and acceptability of the Facebook delivered intervention. We also had sections in our preliminary studies on entitled, "Our multidisciplinary team has the needed expertise and established track record of collaboration." So we talked about what the team members brought in terms of expertise and field, and also how many grants and papers that we have published together. We also had a paragraph on our history recruiting and retaining postpartum women in longitudinal research studies. So not just this study, but other work we had done with postpartum women. We had a section on our history of delivering weight loss interventions via in-person groups and via online social networks to demonstrate that that we can, even if it's not in postpartum women, that we can deliver them both online and in person. And then this paragraph, so sort of overall, we have all these pieces together. So we use this all as preliminary data to get an R34. So an R34 is a really cool mechanism. It's a 3-year grant. It's $150,000 a year, so bigger than an R21, smaller than an R01. And the NHLBI offers one specifically to conduct pilot studies, and specifically pilot studies that will provide critical preliminary data to support the conduct of a fully powered trial. So the whole point of the R34 is to do a pilot feasibility RCT. And they really want you to say, okay, what are the feasibility issues you need to work out now before going to a fully powered RCT? So this is what we're on right now, which is the R34. So our main feasibility outcomes here are recruitment, retention, sustained participation, contamination, and feasibility of assessment procedures. And what's great about the R34 is that they really want you to say in the application of how the information that you'll learn from the R34 will lead to changing or informing the design of your fully powered RCT. So here I've sort of, again, screen grabbed a couple of sections from the R34 application. So for instance, with recruitment, not only are we going to be able to know, can we recruit at the yield that we need, at the recruitment pace that we need, but also are there any eligibility criteria that are excluding an inordinate number of otherwise eligible women that we don't actually need to be including as eligibility criteria or exclusion criteria. Also, one big issue with this is that since we are randomizing women to an in-person versus a Facebook delivered intervention, are there a lot of women who are not eligible, not interested in participating because they're not willing or it's not feasible for them to participate in one or the other interventions. So to really get the sense of under this conditions of randomization, so in one arm pilot, we can recruit women who are happy to do the intervention in Facebook, but the randomized pilot, the randomized one gives us information on whether women are willing to be randomized to either condition. And so here, we talk about if our recruitment rates are lower than expected, we can adjust the recruitment timeline for the larger study next. So similarly, with retention, we will look at why women are dropping out or why they're not completing follow-ups and think about how to keep that high. And with the feasibility assessment procedure, as I mentioned earlier, one of the things that we're measuring is time spent on Facebook. And so sort of working out the bugs in that at the pilot phase is much better than waiting for the fully powered trial. So this is what the plan is. So one other thing that's really great about the R34, which is very much in line with what we've been saying earlier, is that part of that application is to write up 3 pages, which is the design of your subsequent larger study. So you have to have the aims and then as much of the methods, and then which pieces of that design will be influenced by the outcome of the R34 trial.
And having applied for R34s, I can't emphasize enough how important that exercise is. At first I grumbled, I'm like, oh my gosh, I have to write 3 pages of my next application on top of this application, because it's 3 extra pages. But after doing it, I was so glad that I did because it really forced me to think through the methodology, and I ended up going back and making a lot of changes to my methodology because it forced me to think through so much more about exactly what we would be doing. So even though it's a little bit of a time commitment to do that, it's super valuable, and I think that's why they require it with this mechanism. They didn't used to, because I remember years ago applying for R34s and they didn't have that, and I would guess they added it because they were probably seeing so many applications coming in that might not have been as well thought through as they could have been, and so they're doing that not to be annoying and make us work harder, but to really kind of make sure that we're thinking through very carefully and then making the best application possible to increase our chances of it actually leading to an R01.
Yeah, so definitely. So again, it's sort of what we're encouraging for any pilot grant or any seed grant is to think through like what is the next study, what are the aims of the next study, and then what are the pieces of data around feasibility of the proposed methods that you need in order to convince reviewers that the big study that you want to do is feasible and that you and your team can do it.
I love how in the R34 they also kind of force you to consider how you're going to use the information you learn from your pilot study, which is again like another step, and you present it very clearly here, but that's like another intellectual exercise that I think is really important. And then she was able to sort of put in like all these backup plans and contingency plans for various scenarios. So again, that shows the reviewers you're really thinking through all of the complexities of this.
So this is an example of taking, sort of a bunch of work that we had done, getting a seed grant, a very small seed grant to do a one-arm pilot, which then supported a pilot feasibility RCT through an R34, which the next step of which is more planning to apply for an R01 with a fully powered non-inferiority RCT.
And so, I'll just like make one point about that. So yeah, the one-arm pilot, which was this, the 6,000, it was really like chapter, I don't know, 4 or 5 in a book that had already been going. So yeah. It's rare that a one-arm pilot would like be enough for, an enormous amount of funding like an R01. But in all of the different studies that you're doing, you probably, if you've been doing some other studies, you probably do have some preliminary data that would be useful for your preliminary study section. So it's just a matter of sort of thinking through what do we have that would make us competitive for an R34, R21, or R01, and what do we need? So most people, unless you're just starting out, probably already have some preliminary studies, but there'll be gaps. And then that's kind of the point of the seed grant is like to fill in whatever those gaps are. Typically, study sections will want to see a trial run of whatever you're proposing as exact as what you're proposing as possible.
So examples. So this is an example of an intervention study of a line of research that is testing an intervention. I'm also a co-investigator on a project where they did a pilot prospective cohort study with a smallish, I think it was 80 participants first to test all of the methods and all of the recruitment and the assessment procedures and the retention over time, and then use that as preliminary data to get an R01 to do a large prospective cohort study of, I think our final N is 1244, so 1,200 participants, but being able to, that was one of the real strengths that was noted in the R01 application is, this team has piloted these exact procedures and have found them to be feasible. And that was seen as a real strength of us being able to believe us when we said that we could recruit 1,200 older adults with AF.
Right.
It's really thinking where are the gaps. I think one also important thing to think about for preliminary data, especially for junior investigators, is that it doesn't all have to be yours. It has to be the team needs to be able to do it. And so really thinking about as you're composing your team, are there people that you can bring together to work on a project together where maybe they've done something that helps support the feasibility of what you want to do. It can be a little intimidating, for somebody who's more junior to be like, oh my gosh, well, I don't have 30 years of preliminary data on this. Well, you don't need it. Like your team needs to have all the pieces together. It doesn't all have to be just stuff that you've led. And so that's a nice way also to think about, okay, what has the team done that supports what we want to do, and then what else do we need in order for us to be competitive to have the larger study be funded?
How do we see whether there are questions from the group? Because we have just 3 minutes left. I want to make sure that we can answer questions, but in the view we have right now, I can't see anyone, any questions, but.
So while we're figuring out the
Yeah.
technology of finding out how we find out your questions, here are a couple of additional resources. So again, this great study around pilot studies, Leon
Not on my
Davis and Kramer.
This isn't the
And
computer.
then the funding announcement for the R34, so you can see what's required in that 3-pager at the subsequent study. And we would love to take questions. Does it work for anyone to take themselves off mute and just ask a question?
Or they can call.
Let me
I
see
have
if
a phone here if they want to call.
see if I can find another view.
This is why I like having an IT person here.
Okay. You see?
We just have. I don't know. Got it.
What's that?
Deb's
Okay.
Ghost.
Oh, there was one question.
Okay.
Well, it was just a comment. I don't know. I'm just gonna look at the various views. Okay, I don't see any. Feel free to email us a question if you have one and are having trouble asking it. We're happy to answer any questions that you might have.
So this is Debbie Corman.
Okay.
I will make a comment about some feedback I've gotten about the importance of Sea Grants is to actually establish your team as a credible team that can publish together as well and work well together. So there was a grant that we were considering applying for in October, and I talked to the project officer who said, "You're a brand new team.
Yeah.
It would be of great benefit to you to establish yourself as a team that's functional, that can work together and publish together." So we're not going to apply. We didn't apply in October, and probably going to apply in June and try to do some preliminary research before we apply for NIH funding.
And some of the concern around team came from some of those large initiatives like the T-Turks and so on. They have these very large team science initiatives where like they would have like several PIs and that sort of thing. And what they found was that many of the teams that weren't experienced weren't as productive. So even if they're like the biggest rock star scientists in the world, you put 10 of them together, and it doesn't mean they're going to be productive. And there's actually now like an entire science of team science around like how to develop productive teams. They have a website and an organization. You can even go to their conferences, but there's lots of great training materials in the Science of Team Science website to kind of look into like how to construct those teams, because that is a super important point. And we've probably all had experiences on a team that wasn't functioning well.
Yes. I certainly.
And so they don't want to hand over $3 million to people who may not be functioning well. Okay, no questions. That's good at this time. I see in the comments, so I'm glad we weren't leaving anyone hanging there. But I see we're at noon, so thanks for joining us. This will also be posted on the website for InChip, so if you want to recommend it to other people or revisit it, the slides and the webinar itself will be posted. So thank you very much.
Thanks, everyone.
All right, that's a wrap.